Thanks for clicking on Conversations with Crosswinds Counseling. I'm Curtis Smith, and I invite you to subscribe to our podcast and to like and share it as well. I hope you enjoyed today's episode. Hi, everyone, and welcome to Conversations with Crosswinds Counseling. I'm Curtis Smith, your podcast host. Joining us today is Katie Cooley, who is the clinical supervisor for Crosswinds Counseling. Katie, great to see you.
Great to see you.
We are talking about something today that a lot of people might not be aware of, but it's been around for a while, art therapy.
Yes.
We often talk about things that lead to counseling. Today, we're going to focus more on a counseling technique. What is art therapy?
So art therapy is the combination of traditional therapy and the specific training that includes regular therapy. But art therapy is the modality to express yourself non-verbally. So when you think of art, a lot of times you think of the art making process as we know it for, artists. Art therapy uses those same materials, but in a non-verbal symbolic way to reduce symptoms in a therapy setting. Yeah.
Is it especially effective with, men versus women or adults versus children, or is there a population that seems to benefit more than others maybe from art therapy?
I would say it benefits every population.
Okay.
We see, I haven't worked in every population, but my colleagues and what I've researched, it definitely spreads across all populations. So children, there's a lot, and I could just name some that I have worked in, but hospice, so death and dying, palliative care, and dementia is one that I experienced before coming to Crosswinds. And I worked with children. I used it a lot with children in the community health setting. It's very popular with veterans and PTSD, trauma, so that umbrella, and ADHD,
So useful across the board.
Yeah, across the board.
Wow. Is it something that people come in and ask for, or is it something where you work with them for a little while and think, you know what? I think you could really benefit from art therapy.
That's a really good question. I think it could be a little bit of both. So if someone looks at my bio and maybe knows the history, they could absolutely ask from the get-go. But what I do see in my personal experience is I will let them know I'm an art therapist, and usually I get a little bit of like oh, okay. And then based on the symptoms and what's happening in treatment, I will ask, and we end up doing art therapy, and it's extremely beneficial. And then maybe a similar situation to both is someone is being seen, and then maybe there's a team meeting or some sort of referral that someone is aware that they could benefit from creative process and art therapy, and then it comes to me or however the art therapist.
Wow.
But yeah.
So let's talk about it. Let's talk about the nuts and bolts of it. Let's say I come in, I'm someone that you've worked with, and you've said to me, hey, I think art therapy might help you. What happens? I show up and you give me a piece of paper and you ask me to draw something. Do I come in and there's a set of paint, or like what's happening?
Yes, I love this. Okay, so let me think about Curtis. Let's say you come in.
Right.
Curtis.
I'm not asking you to dig in and dive into all my issues. We don't have enough time on the podcast for that.
Let's say you were anxious.
Right.
And you came in and you'd been coming for a couple sessions, and let's say your anxiety, we had started with CBT of, mapping out thoughts and how to process them. Let's just say then yes, I would definitely give you a heads up. I wouldn't leave a piece of paper.
So I wouldn't walk in one day and be like, oh my gosh, what are we doing today?
We would probably have talked about it, and I would say, because I like to tell my clients a lot of times, like, this is what I'm thinking for next time. Would you be interested? Especially art. And I would use a specific intervention for anxiety that maybe could be, and now the materials are vast, but let's just say in this specific session, I want you to process your anxiety, and I would keep it simple, and I would do it in a little bit of an experiential for you, an assessment for me, and I would ask you, maybe I'd give you markers, and that is a cognitive tool, as we call it in art therapy, because all of the materials are on a continuum based on feeling, emotions, symbolism. And so markers are pretty cognitive, and that means you're likely to not flood. And we need to be careful about that. That's why art therapy, we have to go into defining it and making sure that the correct people are facilitating it, which I will get to in a minute because I wanted to define that.
Yeah.
But to answer your question, I would give you markers to choose. You would choose colors, and let's just say this is more of a sorry, I'm trying to think of the word I want. A projective technique where I would just want to know what your anxiety looks like and how you represent it.
And so you would give me a marker and just say, go.
And I would say, just draw how you're
process your
feeling.
anxiety, draw how you're feeling.
Yes. And
Wow.
there's no judgment. That's not about artistic ability. I get that a lot. And I know our other clinicians, we have another art therapist on staff. I know, I would imagine they would get the same intimidation sometimes. But what happens, and this is actually a real client story that I've kind of woven in. Let's just say I did that and you completed your drawing. Then we look at it together and we understand things that you start to uncover. Wow, I actually am looking at these squiggles I made and I'm tying them into some of my feelings and emotions that I didn't think about. And so it becomes that nonverbal language and symbolic meaning.
Does that happen in real time, or is that something that you say, okay, let's set that aside and next time let's dive into that, or is that happening in the moment?
That happens in the moment.
Okay.
And we definitely, as an art therapist, you want to make sure you're meeting the client where they're at, and it's what the art is what the client says about it. It's what they experience. So I have to be careful about, even if something is very clear, maybe just a picture,
right.
You don't want to say like, tell me about this house.
You don't want to define it for them. It's
right.
them. It's really getting them to see it and identify it and define it themselves.
Yes. And you are there to facilitate and hear that and help, and you can wonder and you can ask, but it's very important for the client to start processing that.
Have you worked with people of all different levels of skill? Like,
yeah.
People like, I can't draw a stick figure.
Yeah.
And my wife is an art teacher,
Ooh,
actually.
about that.
Right. So we have in our house, this level of skill around art is a topic, it's a frequent talking point because she is very good at art and I am awful. So I don't know if I would enjoy it. Like if you brought it up to me, I'm not sure I would say, well, I don't know. Let's try some art therapy because I'm so bad at it. Is that a stumbling block for people?
It is, but that's a really good point, and I love that because I feel like a personal connection to that. So I actually started art education as my major and went to art school, being a somewhat artist, like I was pretty good. And then I got to class and it was like, I'm actually not on the level. I'm older than these kids. And they're also like, they can draw a beautiful still life and mine is not. And I had to work at the technique. Right. So I did that. But then what happened is I took an art therapy class and I integrated some of those things we're talking about. I realized why I make art, what it means to me, what the process means to me. So I love that you brought up your wife's art teaching, because yes, there is that aesthetic skill, but I would say like I completely changed my career once I realized this is what I want to help people with, and my art got better. And I know it's not about aesthetic goals, but it changed, and it was more about why am I creating this and what it means to me and all the symbolic processing and expression. And so that's what I encourage with clients is, and of course, if let's say you did that drawing, that squiggle drawing you're talking about, right. And you said, maybe you did process some feelings and insights, but then that just really wasn't my thing. That is completely fine. I never pressure people to continue. What I do find is people are surprised and want to continue. But sometimes it takes more than one session. I had someone that was struggled actually with control issues and anxiety, and the technique I asked them to do was very instruction based, and they struggled with that. And what we found out after that is they've had a lifelong experiences with trauma, and it transpired into OCD, and so it was very interesting. And so 3 more sessions after some similar interventions of how to let go and how to gain control and feel more insightful about their emotions, then they loved doing art and started to really benefit. And they were also worried about their aesthetic. Like, is this okay? Does this look okay? And they really struggled. And so it was a really amazing transformation to where they switched to, now I know why I'm making art and what it means to me and how it can help with my symptoms.
Wow. That's awesome.
Yeah.
Katie, as we wind down here, anything else that you would want to share about art therapy for someone out there who maybe is hearing about this for the first time or has heard about it before but is maybe rethinking, oh, maybe that is something that would benefit me? What else would you share with them?
I would just share that it's an amazing opportunity if you do want to research it more. The Art Therapy Association website is amazing. It has all the things, and including resources and especially locations where you could find art therapists. And I just encourage you to read more about it or try it out if you're feeling like a little stuck in your treatment process and see where it takes you.
Okay, great. Awesome. Katie mentioned her bio earlier. You can see it at crosswindscounseling.org, where you can meet all of the counselors here at Crosswinds Counseling. Katie, thank you so much for being with us on the podcast today. We will see you next time on Conversations with Crosswinds Counseling. Thanks for watching Conversations with Crosswinds Counseling today. I hope it was helpful for you. Don't forget to subscribe so that you don't miss an episode. Like and share it as well. We appreciate that and hope you have a great day.